Hello everyone. Today we are gonna discuss about newer insulin analogues, which can be the future of diabetes care. Let's discuss what are the limitations of current insulin therapy. They are multiple daily injections, requires refrigeration, risk of hypoglycemia, does not mimic physiological insulin secretion, does not deliver insulin preferentially to the liver. What are emerging insulin analogues? New generation insulin analogues are being developed to overcome the limitations of conventional insulin therapy. Major approaches: ultra-long-acting insulins given once-weekly administration improve patient adherence, stable blood glucose control, thermostable insulin stable at room temperature, reduced dependence on cold chain storage, glucose-responsive insulins, release insulin only when blood glucose levels rise, reduced risk of hypoglycemia, hepatopreferential insulins, deliver insulin primarily to the liver, better mimic natural insulin physiology. Once-weekly insulin innovations: insulin icodec, Novo Nordisk, acylated with C20 fatty acid, forms multi-hexamers after injection, slow release, half-life approximately 196 hours, administered once weekly. Clinical trials show efficacy comparable or superior to daily basal insulin. Next is Efsitora alpha, Eli Lilly. Single-chain insulin fused with IgG to Fc domain. Extended half-life through Fc recycling. Half-life approximately 17 days. Once-weekly administration. Lower risk of hypoglycemia compared with other insulin. Other emerging strategies: thermostable insulins resistant to heat-induced aggregation. No refrigeration required. Easier transportation and storage. Glucose-responsive insulins. Smart insulin systems. Release insulin according to glucose concentration. Minimize hypoglycemia. Hepatopreferential insulins target the liver first. Better suppression of hepatic glucose production. Closer to physiological insulin action. Novel linker technologies. Selenium-containing linkers. Chemical stabilization. Longer duration of action. Improved molecular stability. Summarizing the topic: emerging insulin analogues aim to improve efficacy, safety, and patient convenience. Once-weekly basal insulins are nearing widespread clinical use. Glucose-responsive insulins may significantly reduce hypoglycemia. Thermostable formulations can improve insulin access in resource-limited settings. Hepatopreferential insulins better mimic natural insulin physiology. Future insulin therapies are expected to provide more personalized and patient-friendly diabetes management.